Hello, happy Monday. I want to talk to you today about hiatal hernia versus hiatal hernia syndrome. So what a hiatal hernia is, just some definitions. A hiatus is a hole, and a hernia is something that's coming through a hole inappropriately. So you can have it, what a hiatal hernia is, which is the stomach is pushing up through an opening that it shouldn't, which is your esophagus or beside your esophagus. But maybe you've heard of umbilical hernias, so those are around your belly button, or inguinal hernias. A lot of times that's from straining and it's in your groin area. All these are hernias. So again, protruding through an opening that it shouldn't. And hiatal hernia is specifically, again, the stomach is pushing up through the opening for the diaphragm. And it can really widen that opening pretty dramatically, and then you're starting to get a large hiatal hernia where it becomes serious and needs surgery. Is sometimes most of the stomach can be above the diaphragm. That's not what we're talking about. We're talking about a hiatal hernia that tends to be small to moderate. And also the most common type, 80% of hiatal hernias are a sliding hiatal hernia. So that means it's coming up inappropriately, but then it's going back down into position. And let's talk about the position. So your heart is on the left side in your chest. Just below that is your diaphragm. That's that sheet of muscle that when you breathe in, it bows down, and then when you exhale, it bows back up, pushing air out. Now your stomach, again, left side. So your heart's above the diaphragm on the left, your stomach's below the diaphragm on the left, but the stomach should be comfortably below the diaphragm so that the diaphragm can move, bringing air in and out as deep as you want without impinging upon that motion of the diaphragm. So with a hiatal hernia, what happens is that the stomach is spasmed for reasons we'll get into, and then it's pulled up because, of course, the stomach is connected to your mouth via the tube called your esophagus. So as that stomach spasms, it's pulled up, and now it's kind of jammed up against your diaphragm. So in a nutshell, a hiatal hernia is the opening has widened between the stomach and the esophagus, and a variety of symptoms can ensue. Now, my team and I have been doing this for probably 15 years. We've been heavily in the area of, now I'm going to give you a new word, hiatal hernia syndrome. I'm going to define that in a moment. So we've been in this world because in a sort of unexpected way, you can have a very small or subclinical hiatal hernia. I'm going to tell you what that is in a minute. And the symptoms are devastating. People can be absolutely homebound, can't function. We're going to go into the symptoms in a moment because of this hiatal hernia that is either imperceptible or very small. So it's counterintuitive, right? You think, oh, this big hiatal hernia, fine. Then we have symptoms. And that's what people are hearing from their doctor. So a subclinical hiatal hernia, we did sliding. Goes up, it comes back down, right? Up and down. 80% of them are that. I named, when I wrote the book, Hiatal Hernia Syndrome, I named this subclinical variety, which is the stomach is not protruding through yet, but it's spasmed. It's pushed up on that diaphragm. And we're going to be talking about this all week, this week. But we called it a syndrome because a syndrome means a lot of symptoms coming together. And when that stomach spasms and pushes up on the diaphragm, not only can you get acid reflux or GERD, but you can get shortness of breath because, again, that diaphragm is being impacted and it can't move as freely as it needs to. You can get heart palpitations. You can get severe heart palpitations. You can also get anxiety and panic attacks, and that has to do with the fact that when your diaphragm is not moving as well as it should, you're not oxygenated quite as well as you should be, and your stress hormones just kind of do this, kind of like the smoke alarm going off, right? The smoke alarm is, when it goes off in your house, scares the bejesus out of you, but what's the purpose? It's supposed to go, alert, alert, something's wrong. Same thing with these stress hormones being secreted. Your diaphragm's not moving freely. It's pushing up on the heart a little bit, and the stress hormones are secreted to say, something's up, I don't know what. Meanwhile, you either wake up in the middle of the night or even during the day, you have these panic attacks, very disconcerting, very frightening. A lot of times it's the heart palpitations or pressure in the chest that gets someone off to the ER. They go to the ER and they're inevitably told they're fine when it's this causing it. So what we're talking about is a primary issue with hiatal hernia syndrome, stomach spasmed, pushing on that diaphragm. Remember, it should be nicely relaxed. The stomach is a bag of acid. It should be nicely relaxed below the diaphragm so it can function, the diaphragm can function, and the heart can function effortlessly. But everything's pushed up on top of each other, and you can get the heart palpitations, etc. So I wanted to give you the overview today, Monday, of what is it and what is hiatal hernia syndrome and all the attendant symptoms associated with that. And there's actually 20, so I'll be going into those tomorrow. But this is absolutely something that's affecting, if it's not affecting you, you likely know somebody it's affecting. And whether it's the acid reflux, the GERD, the pressure in the chest, trouble breathing, waking up in the night with a feeling of anxiety or sometimes choking on the acid. There's a lot of manifestations to this, and the good news is with a natural program, it can be cured. So in most cases, I always have to raise my index finger like a little school teacher, but with compliance, it can be handled in a very high percentage of cases. So we're going to talk more tomorrow about the ins and outs of the symptoms. And yeah, tune in if you like this information or you know somebody who you think might be suffering. Please tell them about the lives. I'm really going to strive to do these at the same time this week with patients. It's always a little interesting to stay on schedule. But yeah, it's going to be a whole week on hiatal hernia syndrome, and what you can do about it. So I'll see you tomorrow. I hope you found this video helpful. If you want more on this topic and others, click here.